Hi, good morning. How are you today?
Doing well. How are you?
I've been doing good. How's your day been today so far?
Been pretty good. Haven't really done much, but
Yeah, I gotcha. Well, I want to thank you for taking the time to meet me with me today. My name is Natalie Guevara Reyes, and today I wanted to take the opportunity to meet with you and discuss a couple of questions about your career path. How did you get to where you are today, and where do you see yourself in the future? Like I mentioned, this interview should be taking around like 10 to 15 minutes. But does that sound all right so far?
yeah, that's fine.
Perfect. And do you have any questions before we start?
No.
Gotcha. All right. So my first question to start off with is tell me a little bit about yourself.
Well, my name is Nalea Gonzalez. I am 22 years old. I'm currently based in Lake Charles. Um, I have experience in healthcare. That is my main area. Um, I've worked in hospitals and clinics. I'm a certified phlebotomist, and I have experience as a medical assistant, uh, and nursing assistant. And yeah, pretty much.
Perfect. And then are you aiming for a specific nursing specialty in any way?
Want me to eventually be a nurse. But if I do get to that, I would probably want to be an emergency room nurse.
Perfect. And I was about to say, since you mentioned you wanted to be an emergency nurse, so I know like in that job, it's critical in skills of measurable, technical, and clinical proficiencies. And what skills do you have to have that would best fit you for that role?
So I feel like doing well under pressure is a main thing because, people get to the ER super quick and you just got to do everything at a fast pace. Also, time management to know what order to do things and like how long to take doing them. Um, Also, computer literacy, that's a really big one because, technology's everywhere.
Mhm.
So I feel like that'd be the main three.
Yeah, perfect. And then kind of like going on that, please name your five strengths and then what are your five weaknesses?
Five, sorry. Communication's definitely one.
Mhm.
Teamwork, uh, time management, so the working well under pressure.
Mhm.
Um, and yeah, computer literacy, that's, yeah.
Perfect. And then
And
how, yeah, weaknesses. Yes.
my weaknesses, I would say asking for help after like I've tried to do everything. I don't know about much about it. Uh, yeah, I can't really think about any other
Yeah,
ones.
no, that is totally okay. Yeah, so moving on to my next question. What has been a challenge that you have dealt with, especially with a tight timeline, especially with working in its fast-paced and hectic environment such as a hospital, and how did you overcome it?
Um, well, in the mornings, the patients would get super angry
Mhm.
because we would go in and draw their blood really early. Um, so the way that I would handle it was I just let them know that it's the job that I needed to get done, but that if they wanted us to come back, we definitely could. We didn't want to pressure them into doing their blood draw because that's also not good.
Mhm. Exactly. And then let's see. And please name a time that you worked with a team within your time working in the nursing field, and how did you deal with like that type of conflict, and how did you respond to it?
So with my team, obviously that's the group of phlebotomists. Um, we would sometimes argue about what needed to be done and the priority of other things. Um, the way that we would resolve it would be to send some people to go do this stuff and then other people to go do the other stuff, so that we would get them done in a timely manner and get them done efficiently. So,
Perfect. And then let's see, my next question for you is name a time where you have been proven successful in a project or an assignment, and how did it contribute to your success?
so, towards the middle, 2020, 2021, 2022, 2023, 2024, 2025, 2026, 2027, 2028, 2029, 2030, 2031, 2032, 2033, 2034, 2035, 2036, 2037, 2038, 2039, 2040, 2041, 2042, 2043, 2044, 2045, 2046, 2047, 2048, 2049, 2050, 2051, 2052, 2053, 2054, 2055, 2056, 2057, 2058, 2059, 2060, 2061, 2062, 2063, 2064, 2065, 2066, 2067, 2068, 2069, 2070, 2071, 2072, 2073, 2074, 2075, 2076, 2077, 2078, 2079, 2080, 2081, 2082, 2083, 2084, 2085, 2086, 2087, 2088, 2089, 2090, 2091, 2092, 2093, 2094, 2095, 2096, 2097, 2098, 2099, 2000, 2001, 2002, 2003, 2004, 2005, 2006, 2007, 2008, 2009, 2010, the end of my phlebotomist career or job that I had, um, eventually they would call me to
Hmm.
go draw blood on like a hard stick patient because they knew that I would possibly more than likely be able to get it. So that definitely helped uh, with like my end of the year review
Hmm.
stuff, you know.
Yeah,
So
exactly.
eventually
Yeah,
led to like raises and praise and stuff.
that's good to hear. And where do you see yourself in 5 years within this industry?
So I definitely see myself becoming a nurse, and getting that emergency room job, you know. Um, and I don't know, hopefully with the family, you know.
Yes. All right. And then for my final question for you is how is working in nursing changing you in your professional and personal growth?
So it has changed me in my professional growth because it definitely confirmed to me that that's what I wanted to do. I mean, it's always been in my mind since I was young, but it definitely showed me a new perspective to look at things, and it just confirmed to me that that's my area. Um, and personally, it has made me grow because I've seen a different perspective on life and how to think about things. Just seeing how these patients are in the hospital and how they get better and the support that they have, you know.
Yes, perfect. So again, thank you so much for taking the time to answer those questions. So just to go over what we went over today, we basically talked about your background as becoming a C, like, well, as you're nursing. You have done a phlebotomist, you have worked in a very, again, like a very hectic field with so many patients all around the clock and trying to get those assignments done and all those conflicts and how you address those. But I love getting to know more about your field. It was very interesting to get to know more about somebody like from that's not in that industry to see like what it is on the other side. But yes, but again, thank you again for taking the time to meet with me today. And I'll follow up with an email later this week. And thank you again.
Thank you.